Thank you. Thank you for joining me on such short notice. We're here to hold an emergency meeting on COVID-19 coronavirus and to consider declaring a local state of emergency. The declaration gives the administrator the authority to approve expenditures and to issue special orders as needed to ensure public safety during the COVID-19 local response. I will now turn it over to our County Administrator, Barry Burton, for some important information.
As you know, the World Health Organization has elevated COVID-19 to pandemic level. At this very time, President Trump is holding a press conference, and it's anticipated there'll be a national emergency over the pandemic. While Pinellas County still has 2 positive cases, both are travel-related, and isolation is under and appropriate testing for those cases. The governor's declared a state of emergency, as has several counties. The Department of Health still remains the lead agency in Florida and is working on containment and mitigation per the guidance from the Center for Disease Control and Prevention. At the county, we continue to support the Department of Health Pinellas, which is our lead local agency, with proactive planning and coordination of our local response. To give you some highlights, we've been holding regular conference calls in coordination with our executive policy group, appointing authorities, and all of our municipal partners. The Emergency Management Department is coordinating response on sharing resources with community agencies and partners, especially serving our most vulnerable populations. We've enhanced sanitary protocols and installed sanitation stations in high traffic areas. We've also worked with our employees and our management on regular updates. I really want to thank all of our municipal partners and our other agencies in working together. This has been a very fluid situation, and daily coordination calls as to what next steps are needed has been necessary. Pinellas has a strong response team, and I want you to know that everybody's dedicated to making sure that we have safe procedures in place. Our focus at this time, though, is at slowing down any potential onset of the COVID-19 so it doesn't overwhelm our health and our emergency response. We know that the best way to mitigate this response is by limiting social interaction. We also know that we can prevent the spread by limiting in large public gatherings. It's important to know that we want to make sure that we have the authority to act appropriately given the individual events that can occur. As we also know, we have a lot of events in Pinellas County. Florida law allows the county to declare a local state of emergency and lift some of the standard procedures in order to keep people safe. Today, I'm asking you to declare a state of emergency in Pinellas County and delegate the authority to me as your county administrator to do what is necessary to respond to the COVID-19 issue. I would like to have your approval to make decisions and approve expenditures necessary for public safety. This would include considering canceling mass gatherings where large crowds would gather, and this would be to protect the public and to help our first responders. Issuing increased procedures for screening and reduced visitation at all long-term care facilities, such as assisted living facilities and nursing homes, where some 13,000 Pinellas County citizens reside. Other special actions would also be considered as warranted. The declaration is in effect by state law for only 7 days, so this will require continuous monitoring and coordination with the Board of Commissioners as this progresses. At this time, I'd like to ask Dr. Cho, the Director of the Florida Department of Health in Pinellas County, to come up and provide you a situation update regarding our response.
Good afternoon.
Good afternoon.
So I last gave this presentation on Tuesday just to give an update, and many things have changed. And I think it underscores the fact that this is a rapidly evolving situation. Some of these cancellations have been unprecedented. So with that, making sure that we're equipped with the right information, I stress that getting the right information using the CDC and DOH websites. Now, in terms of a situational update, in terms of our numbers, we still have the 2 travel-related cases here in Pinellas County. They remained in good health and in isolation. And like with any infectious diseases, we're doing the appropriate epidemiologic investigation, quarantining those that had close contact with those individuals, testing them if they were to develop symptoms. Now, I'm sure you've also been tracking some of the numbers that have been increasing worldwide, U.S. and in Florida. The numbers as of a few hours ago was 136,000 worldwide, with 5,000, close to 5,000 deaths in the U.S. It was 1,268 with 33 deaths, and in Florida, 42 residents, 5 repatriated Florida residents, those are people in federal facilities, and 3 non-Florida residents staying in Florida for the time being, and still with 2 deaths in Santa Rosa and Lee counties. And as I mentioned on Tuesday, our primary focus is containment and mitigation strategies. I don't know if you've seen that hashtag, flattening the curve. I think that's what we're trying to do with those kinds of strategies. The goal is to delay the epidemic so that it doesn't overwhelm our healthcare system. So it gives us time to get our resources in order, to not overwhelm the ERs, the hospitals, and the ICUs, to somewhat flatten and delay that epidemic. The state has declared a state of emergency as of March 9th. And again, if you need the hotlines, again, we've established hotlines at both the state levels and local levels. And I can certainly send that out again. And again, you can take personal actions. And I'm going to say this again and keep saying this. This goes with COVID. This goes for the flu or any respiratory illnesses. Just making sure you wash your hands. Staying home when you're sick, not touching your face. And at this point, I don't recommend any handshakes, so let's do that elbow bump as well. And then working with community partners to get that messaging out, taking those mitigation strategies. So I'm fortunate to have a lot of great community partners here in Pinellas County. We're fortunate to have these dedicated public health professionals really dedicating their time and energies to really getting a handle and addressing this epidemic. Something I highlighted on Tuesday and something I think Barry mentioned was the nursing homes. What we need to focus on is our vulnerable populations, those that are over 65, those with chronic health conditions, and again, those are heart disease, diabetes, lung disease, those with cancers, those are on immunosuppressive therapy. The governor on March 11th sent out an executive order limiting visitations. So if you've been in contact with someone with COVID, you're exhibiting symptoms, if you've been to international travel, on a cruise, a number of other things on that list, trying to minimize that contact with that vulnerable population, just taking that precaution, I think is important. Now, in terms of testing, we continue to test at the Department of Health. We continue to use the CDC guidance and prioritize some of those individuals that are our highest risks for COVID, and at the same time working with community partners to facilitate enhanced testing. The private labs, LabCorp and Quest, have come online earlier this week, and they've actually finally got testing rolling in those facilities as well, and hopefully we'll see them continue to grow. Additionally, the state has worked with the hospitals, these other CLIA certified labs, to increase lab testing capabilities, hopefully with the hospitals real shortly. And the governor announced that the state has also ordered additional tests, about 25,000, which would test over 600,000 individuals as well for the labs. Now, with this growth of the number of cases that we're seeing at the statewide level, I think it's important to not only practice those personal protective measures, right, washing your hands again, but also practicing those things that we can do in the community, like social distancing, especially if you're sick, especially if you're vulnerable in that vulnerable population group. And I know there was a lot of discussion with the mass gatherings. There was a number of cancellations, both locally as well as nationally with that. Governor DeSantis has recommended that the local authorities strongly consider canceling mass gatherings. And that's defined sort of loosely as an event that attracts over 1,000 individuals, but also is defined as something that can potentially put a burden on our resources within our community. So a little bit of flexibility there. So I think we need to continue to take those types of measures, work with the community partners to really flatten that curve. And if the local state of emergency does assist in those mitigation strategies, I do support that from the Department of Health.
We had a conference call right before this with all the area city managers discussing preventative measures, looking and evaluating the types of events we have coming up, and trying to make a coordinated response to a good decision making. This gives us the authority to have that interaction and make a timely decision And it's for that reason that I request that you respectfully approve the declaration.
Question?
Yes.
Dr. Cho, again, if you could remind us of I think there's 4 or 5 symptoms. Do all 5 symptoms have to exist before you should go seek a test for it? Or at what point should somebody try to get tested to see if they actually have the virus?
That's a great question. What I would recommend, we have that open line that links to our epidemiology unit. There has to be all these factors you look at. The classic symptoms for COVID does include the fevers, the dry cough, shortness of breath, among other things. But as we learn more, this is a novel virus, so I think we learn more as more people unfortunately get infected. So there's a number of things that we're learning. Some are asymptomatic, some have milder symptoms, but really focusing and testing those with those classic symptoms.
So they should call a certain number at the health department to go over their symptoms to find out what their next step should be?
Yes, locally that number is 727-824-6900. And there's also a state hotline at 866-779-6121.
Okay. Thank you, Dr. Cho.
Okay.
Commissioner Long?
Yes. Good afternoon, Dr. Cho. It's nice to see you here so soon. I would like to ask you a few questions, if you don't mind, Madam Chair, because I've been talking with the CEOs of some of our hospitals this morning, and I think I heard you say, please correct me if I'm wrong, that the governor had ordered an additional 25,000 tests.
Yes, ma'am.
That seems to pale in comparison to the fact that we have almost 20 million people in this state.
As a correction, it's 2,500 kits, and it can test up to 625,000 individuals, I believe.
Okay, so please say that again, because I want to write it down.
It's 2,500 kits, which can test up to, I think, over 625,000 people.
Okay, and then, so we have Johns Hopkins University here in our backyard, and I'm curious about whether or not, because I heard coming here today on my POTUS station, which I listen to regularly, that they are doing research and have the capacity to manufacture the test. Is it possible that our business community and those pharmaceutical companies within our county can help us with putting tests in the marketplace?
That's certainly a possibility. I know there's a lot of work in that field nationally, and I believe there was a few universities that have developed their own testing kits. But at the same time, I believe the state at this point is trying to reach out and directly give the kits to some of those hospitals and other CLIA-certified labs.
And then what about the respirators and masks and protective gear that our EMS and first responders need when they are responding to those type of calls? Do they have sufficient supply?
So, and that's the beauty of working with community partners, working with EM, and setting up an incident management structure. So with the logistics arm of those organizations, it is important that we keep a supply. The concern here is that this outbreak could last a number of months. So with that, we have to take into account both those PPE issues, those resource issues, but I would also add the human resource issues as well.
And thank you for bringing that up. This is my last question for now. If you've been in the grocery stores recently, you know that it's as though we're having a hurricane. Basic supplies shelves are just totally empty. And I did speak today with a manager of the Publix that I shop in to ask if they were getting daily supplies and have they been in touch with their suppliers to maybe get an indication of when they might be able to restock. And so because they haven't been able to find out that information, I'm wondering if we have any kind of capacity to find out for our citizens when they can expect to be able to get their hands on things like hand sanitizers, Clorox wipes, and those types of materials that we use in our own homes and in our workplaces to keep us safe.
Right. So I think, again, working with EM, looking at, keeping an eye on those types of issues, because it's somewhat hard to track what the shortages are at each site. But at the same time, everyone focuses on hand sanitizer. What I do want to say is that soap and water are even more effective sometimes than hand sanitizers. But so in terms of supplies, to my knowledge, there's not a shortage of that at this time. But certainly we do have concerns with the hand sanitizer issues, as well as Clorox and wipe issues. Cleaning product issues.
So do you know if our central warehouse that the state has, I think it's over in Lakeland somewhere, if they have supplies like additional
Kathy's
beds
coming
for our hospitals or some of the masks and equipment that some of our healthcare providers need?
So one of the things that we're coordinating, Kathy Perkins, Emergency Management, we're coordinating with our local responders, hospitals, ALFs, nursing homes, is we are doing a resource form to understand what their current capacity is, what their burn rate is, and then what additional things that they need. So that way we can send that up to the state, so we can coordinate with the state and prioritizing that, because just as we've all mentioned, everybody's competing for the same resources. So we're working to make sure that we know what the needs are locally, so that way we can put in those requests.
Thank you very much, and just thank you so much for being on top of all of this, and if you can let us know, I'm sure Barry will, as new information comes forward. It's very helpful for those of us who have circles of influence and opportunities to communicate as well.
So we are also standing up, effective today, a webpage that'll be dedicated to keeping this information up to date. And we've, this has been tracking daily, and so we've been referring people to the Department of Health to try to have centralization. But because of, as this thing progresses, that'll be effective as of today.
Commissioner Welch?
Thank you, Madam Chair. Thank you, Dr. Cho, for coming back, and Barry for your team putting this together. You told us Tuesday this would escalate quickly, and it has. In fact, that night I think we had our first 2 cases. But I just, again, want to repeat, thank you for your leadership, for your calm way of putting information out. And I think that's exactly what we need. I had the same questions that Commissioner Long had. Folks need to do what you said, wash your hands, stay away from folks that are sneezing or coughing, but they don't need to run and grab all the toilet paper in Kmart.
Right.
We're not there.
Right.
And so
They
folks-
have, that's the
I know, but
Yes.
they need to hear that they don't need to do that.
Right.
We're not at that point. We need to be in a preventative mode, so thank you for putting that information out. So my question is, in your conversations, have the schools indicated what they might do?
I just got off the phone with Dr. Greco. They're monitoring the situation as we speak. Obviously, next week is spring break for them, so it gives them a bit of time. So they're still waiting to make some of those decisions at this point.
Okay. And my second question is just, not a big issue, but number 9 that talks about the facilities. If the state has already done that, why do we need that in our emergency order?
This is concerning the nursing homes and assisted living facilities.
So we want to continue to lean forward, Commissioner. We want to ensure that all of our facilities here locally are enacting the measures that they need to take to help keep those populations safe.
And
So
the governor's order was more general. This is very specific.
Okay.
So we're taking the action to say you will limit interaction at our long-term care facilities, and you're required to have preventative measures in place to screen those that are coming into the facility. The sheriff has agreed to deliver this letter that we're going to prepare from me to them, hand deliver that to each and every facility that we have in the county.
And I know you, Lourdes, responded, I think, with the number of facilities. How many facilities do we have that would be covered?
Yes, Commissioner. So we have 71 nursing homes. We have 177 assisted living facilities and 14 adult daycare. So there's some other ones that we also need to get additional numbers on.
Okay.
This
Thank you.
covers over 13,500 residents.
Okay, what was the 71?
71 nursing homes.
Okay. Thank you, Madam Chair.
Thank you. Just a couple of points. Sneezing is not a symptom. I'm looking at all the oak pollen out there. Sneezing and runny nose are not symptoms of this disease.
They're not the classic symptoms, but if someone is, in theory, infected with COVID and they sneeze, they could spread
Well,
it that way
yeah,
as
but-
well. Yeah.
The more likely one is.
Oh, I see, yes.
Yeah, okay.
And that's the difficult part about this. It's allergy season, the pollen's out. The
Right,
flu,
that's
flu
right.
is a pretty big activity, and all of those can present very similarly. So that is the
Okay.
concern there.
But you're going to probably feel a lot sicker than you might with just a normal cold, if you actually have it. Sure. Justice?
Thank you, Madam Chair. Any word on any changes, or I know the supervisors put out a list of polling place changes, but do we have any other changes beyond what she's already put out?
Not
The-
yet.
The only, we had her on a call, we had a partners call with all of the appointing authorities just at 1 o'clock, and no additional changes other than what was previously mentioned.
And thank you.
Only-
And then,
Okay. Change being that we could use volunteers because people are
That is correct.
declining to do that, and the election system runs largely on volunteers or part-time workers.
and then I just wanted Mr. Burton to, I saw part of the email out, but the steps that we're taking as far as informing and making accommodations for our county employees.
Well, we'll have internal communication with county employees. Again, we've got enhanced cleaning procedures and things in place throughout. Where we can limit and have opportunities for people to work remotely, we'll be rolling that out also. But again, it's to limit the social impact to, we had a large meeting on Friday that we canceled because, that's something that can be postponed. But we're not closing operations, we're not shutting down, we're still open for business. We're trying to take enough preventative measures to contain and prevent as necessary.
Yes, Commissioner Long.
Ca-
Sorry, yeah, I got you.
Okay. Kathy, I'm sorry, but I know you said there were 71 nursing homes, 117 assisted living.
177.
Oh, that's a big difference, 177. And did you say how many hospitals or hospital beds we have in this county?
We have 17 hospitals. Their licensed capacity is 4,208.
4,300?
4,200.
4,200.
4208.
Okay, thank you so much for repeating that.
You're welcome.
Commissioner Eggers?
Yeah, just two things, just to follow up a little bit on what Commissioner Welch said about, I'm using the word because I think it needs to be said, hoarding of product. We get disgusted about the gouging things that go on during these shortages, but I think people need to realize that there are a lot of folks that are in real need for some of these supplies. So if you overtake and they don't have it, I've seen already on some of the local social websites, people begging someone to give them some product because they can't find it. So everybody needs to calm on that point and take just what they need to the best that they can. The other thing I just wanted to mention real quick is that Tampa Bay Water has indeed is addressing these kinds of issues as well. Has been in touch with all the utility directors and have implemented their infectious disease control mechanisms as well. So making sure, inventorying all of our supplies and all of our materials that we need for the water, just to make sure that there's no issues there as well. So they're trying to stay ahead of the game as well. I just wanted to make sure that we pass that along today too. Thank you.
Commissioner, I just want to make sure the message to the public that I really want to share is that this is a time for all of us to be kind and compassionate.
Yes.
And we all need to look out for our neighbors. So especially if we know we have a neighbor that's in this vulnerable population, check in on them, get their phone number, help them with the supplies that they need. If you have some additional stuff, this is the time for all of us to come to the plate. We're continuing to talk with all of our service providers that provide feeding on a regular basis to our vulnerable populations, but we're also going to be including, all of our corporate partners as well. What can we do to continue to lean forward to support one another during this time? Because as Dr. Cho said, this could be a long duration. I keep telling my staff this is a marathon, it's not a sprint. So, we just need to be kind and compassionate. We have to look out for one another, and we have to continue to think about what are those areas that may be vulnerable. How do we support the entire population?
Well said.
That was beautifully said. Thank you so much.
Thank you. And I wanted to take this opportunity to thank you all for responding as if it was a sprint right now, even though we know it's for the long term. You've done a lot of work in the last few days. Things are happening so fast. And I want to thank all our partners and our staff for just stepping up to the plate, because we're all in this together. I like what you said a lot. Okay, will entertain a motion to pass this resolution.
Move approval to pass the resolution.
Second.
Okay, we have a motion, oh, I don't have my little voting thing. We have a- we have a motion by Commissioner Long, second by Commissioner Akers.
Yes.
And all in favor say aye.
Aye.
That was unanimous. Do you want parting words?
That's the extent of our comments.
tuned.
Obviously, we will begin updating the information. We will be passing this out to all of our partner agencies and updating our website. We will continue to push information out to the commissioners on a daily basis as information develops. And again, make sure that we keep our residents informed. I do want to say, as this moves, some of the procedures and things have changed in terms of, what to do. Do you call when you because you went to an event, or do you, how do you act? So I think everybody just needs to stay tuned, because these events have changed literally daily, so.
And this, as we were speaking before the meeting, this resolution is good for 7 days, so we'll have to come back.
That's a great point. This is for 7 days, so early, as this progresses, we'll again keep the commissioners informed and talk about the next step if we need to extend it.
Okay. And that being said, we are adjourned.
Thank you very much.
Thank you.